This is Fox 5 News, the most powerful name in local news.
All right, Nick, hot July, scorching weather with the added twist of an air quality alert. So how is this affecting our health?
All right, well, joining us is Dr. Rahul Sharma, an emergency room physician at New York Presbyterian-Weill Cornell Medical Center. Thanks so much for being with us, Doc.
My pleasure.
First of all, what factors need to be in place for air quality alerts to be issued?
Well, certainly the humidity, the ozone level, the heat, and also the pollution level in the city. Those are all factors that are required to be present. Now, the EPA actually puts out an index every single day for a city, and based on that index, you'll know exactly what kind of people are at risk to develop complications.
Yeah, that's what I wanted to ask you about. With all of the things you're talking about, all of the factors, it could be dangerous. Who are the people at risk?
Well, I think certainly patients with underlying lung problems, asthma, emphysema, COPD, these are certainly patients at risk. However, elderly patients and the very young as well are at risk as well.
All right, so the State Health Department is recommending that people limit their strenuous activity outside during these alerts. But what if you're perfectly healthy and you're in great shape?
Well, you'll be surprised, but normally functioning people with no medical problems actually do get problems from this heat. They could have respiratory problems as well. Anytime you're out in the heat, your body's at stress. You're losing more heat, you're losing more water, and pretty much this puts you at risk of heat exhaustion as well as develop some sort of respiratory problems such as...
So we want to try to help people out, doctor, right? So what are some of the symptoms people should watch for, and what should they do about it?
Well, the symptoms for heat exhaustion are nausea, dizziness, feeling lightheaded, basically not feeling well. Right. If you have respiratory problems, even a normal person could start having problems breathing, taking really deep, shallow breaths as well, maybe even wheezing. These are things you should look out for.
Stay indoors, take your medication. I've been using that neti pot, by the way. I think it's fabulous.
He's going to do a commercial
That's
for
great.
them.
I think I'll start.
All right. Dr. Rahul Sharma, thank you so much. I got to tell him to stop running 10 miles in the park every night.
That's right.
It's ridiculous.
Thanks again.
Thank you. All right, and that's going to do it for the Fox 5 News at 5. I'm Dari Alexander.
And I'm Ernie Anastos. Harry Martin tells us what's coming up next at 6.
Ernie and Dari, we are just...